Hello, this is Dr. Gay from First Lake MRI, and this is another pattern recognition exam here, just to take a quick glance and try to make a diagnosis. I'll go forward and backwards a little bit, and there's a pattern of marrow edema down here, and the question is, what is that pattern of marrow edema suggest? So I'll give a few seconds to decide. And there we go. Hopefully you made up your mind. So in this case, we look for the medial meniscus to see if we have a radial tear or something that's causing abnormal stress. And we do not have a tear. The meniscus is normal in size, position here as well. It's not pseudo-extruded. So there's no abnormal stress there from a bad meniscus. And it's not really in the articular surface. It's away from the articular surface. So in this area with a lack of any other findings, we think about a stress fracture. So marrow edema can be related to overuse. Sometimes people start jogging for the first time, or jog further than they ever did before, or they join the military, or all sorts of things, go for a long hike, and they get these stress fractures. Again, sometimes it's hugging the articular surface, a lot of times it's off in the metaphysis, kind of like this, centered. And now we're going to put up our T1 weighted view to see if we can see the fracture line. Sometimes you'll see a fracture line on these you do not see on the T2 weighted images or the PD fat set images. And there it is right there. So we see this little horizontal transverse band of low signal. This is a subtle stress fracture, and we have the surrounding marrow edema. So that's it, a stress fracture of the medial tibial metaphysis. This is a sagittal view here, and here we see the patchy low signal, the stress fracture, and the marrow edema that's better seen on these PD fat sat images. And that's it. Thank you so much.